This is the Emergency Medical Minute.
My ongoing series of everything you know is wrong. We talked about being NPO before surgery, right? Have we ever talked about that? Yeah, and fluids and all that kind of stuff. Does anybody know where that came from, being NPO before surgery?
Someone intubated someone and someone vomited.
Right, they vomited, right. And you're worried about aspiration, right? That's the key, is that you're worried about aspiration. And when do people aspirate? When we use ether to put somebody to sleep. Who's used ether to put somebody to sleep? Anybody? We have a big supply of ether here in the emergency room, right? No. Not even me, and I'm old. I've never used ether to put somebody to sleep. It's crazy. I mean, we put people to sleep all the time, and I've never seen anybody vomit or aspirate when we put them to sleep. And plus, once they're tubed, vomiting is much less of an issue anyways. But anyways, the thing about being NPO before surgery too, the other problem is that surgery is kind of a big stress on somebody's body, a physical stress, a psychological stress, and some surgeries go on for hours and hours. Who's been under stress here before? Anybody? How about this? Who's ever run a 5K, a 10K, triathlon, a marathon? Anybody? Do you guys all go NPO the night before and don't do anything by mouth right before your race? That makes perfect sense, right? That's why they do it for surgery. No, so they figured out in England a few years ago that actually PO fluids before surgery is actually a really good idea, that people who are drinking half-strength Gatorade a couple hours before surgery actually did way better in the surgery than the people that were kept NPO. So, when the ortho people always ask us when their last meal was. I don't know. They always want to know that. Anyways, so my wife recently went in for some surgery, elective surgery, but it's a long surgery. And they told her she needed to drink 2 glasses of half-strength apple juice before the surgery. So we went into the hospital, and I got to talk to the anesthesiologist, and I said, "What's up with the apple juice?" I thought it was Gatorade. Because the Gatorade thing I knew, the apple juice thing I didn't know. And what he explained to me is that the Gatorade, half-strength Gatorade, is actually perfect for people. It has sodium, potassium, it's got the fluids, and it has glucose in it. And glucose actually activates the sodium-potassium pump in your stomach and in your intestines to get you to absorb the fluids and so forth. The problem that they're finding with America now is that we have all these weird Gatorades that don't have any sugar in them. Everybody has G2 and blah, blah, blah. So rather than try to explain to the patient that you have to go to the store and ask the clerk for original formula Gatorade because you can't have the G2 and it has to have a certain amount of glucose in it, the easier thing to do would just be use plain old apple juice over the counter. So now they're doing half-strength apple juice.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.